Great. Thank you, Justin. And hello, everyone. My name is Matt Bogosian. I'm the Executive Director of AMCC, American Manufacturing Communities Collaborative. Want to say thank you to our Utah manufacturing community led by Dr. Talinda Larson and, of course, Justin Bott for helping us put on this real-time snapshot webinar. We've done this one time before with our partners, CREC, the Center for Regional Economic Competitiveness. Our thanks to them for our partnership. So we're all adapting to the COVID-19 crisis, and we have a crisis with respect to producing the right amount of PPE in the right time, place, and manner. And AMCC, the network of AMCC manufacturing communities around the country, are on weekly calls and have been for years. Really, the manufacturing ecosystem in the United States is very much reflected in the AMCC membership. And so as a result of one of those weekly calls, as we hear best practices from different regions around the country, a few weeks ago we learned from the state of Washington that there are some entrepreneurs up there, former Microsoft and other entrepreneurs working with the state of Washington to come up with more predictive analytics for PPE. And so that free open source model is being worked on in Washington, and we shared that on a previous call, and the state of Utah took it up and is looking to utilize that model with the work that they'd already been doing around PPE. And so we thought we'd put on another webinar to give another snapshot of what's going on, how one state of Utah, has followed up and is looking to utilize that webinar. I want to say thanks to everybody on the call. I can see we have an incredible turnout from state capitals, from Capitol Hill, from federal agencies, state agencies, of course the AMCC network, and other folks dedicated to respond to the country in the best way to this crisis. So what we're going to do now is turn first to Teresa Foxley, the president of EVC Utah. She works on the state's task force on the economy, and so is tied in with efforts there already to anticipate PPE needs in that state and how they are grappling with the possibilities of using this new model to perfect their work and respond to the needs in their community. The ambition here in presenting this webinar is really for all these listeners to, in states and regions around the country, to think to themselves, well, maybe we could use this model. And you'll hear from, after Teresa, you'll hear from Rich Tong, one of the modelers, who will describe the model and how you might be able to use it in your region so that we can save lives. So that's the agenda. This is expected to go for another 50 minutes. And so without further ado, let me introduce Teresa Foxley of Utah. Teresa?
Hey, well, good morning, everyone. And I owe you, Matt, Dr. Larson, Justin Bott, and so many other participants on this call a huge a debt of gratitude. And that certainly includes Rich Tong, Barat, David Sarley, and others that you'll hear from later. I apologize that I shouldn't have been the first one to go. Those gentlemen should have preceded me, because it was their model that really inspired the work that we're doing in Utah. And not only were we inspired by their model, but they were extremely generous with their time and being willing to help us understand what the model looked like, what it was trying to accomplish, and how we might be able to use it to accomplish some of our goals in Utah. So a quick bit of background, as Matt mentioned, I serve on the Governor's Economic Response Task Force, and we realized that access to PPE would be critical for us to be able to ease some of the social distancing requirements, but to do so in a safe way. And so as our state moved from red health guidelines to orange health guidelines, we started with what Dr. Larson calls a bottom-up approach. And that was by surveying Utah businesses to get a sense for what their anticipated PPE usage would be, and the delta between that usage in an orange phase as compared to pre-COVID, and then their confidence level and their ability to procure that PPE from their existing vendors, their existing supply chain, or out in the market. And unfortunately, we found that 43% of Utah businesses surveyed lacked confidence in their ability to get PPE. And that's when we stumbled through Dr. Larson upon the Washington model. And I'm gonna click screen share here and pull up my document here, which is a PowerPoint presentation that we put together on this matter. Let's see here, allow Zoom. You know what? I am not going to be able to show my PowerPoint, it doesn't look like. But let me just basically walk through what we were able to sort of use this Washington model to accomplish for the state of Utah. So we evaluated the types of PPE that they looked at in Washington, and those were gloves, disposable gowns, face shields, masks, sanitizer, and sanitizing equipment. And then we did this PPE projection process where we looked, oh, terrific, you do have it there. If you could if you could just go to PDF page 3. One page ahead. Thank you so much. And then we, again, taking a page out of Washington's playbook, we wanted this to be Utah specific. And so we looked at all of the standard occupation classification codes in Utah. We assigned oh, terrific, you do have it there. If you could just go to PDF page 3. And we assigned a risk level to the occupation code based on OSHA guidance. And based on that, we then created this model to determine the daily, weekly, and monthly quantities of PPE that would be needed statewide. And we assigned a cost to that. If you could switch to the next slide, that would be terrific. And what we realized is that with a workforce of 1.6 million, the total cost of PPE for the state would be about 114 million, or a cost per capita of $72 per employee. And we took this information back to the state of Utah, and they said, you know, we can make some CARES Act funding available to small businesses and the ones who are in most need of being able to access this PPE. Oftentimes the businesses that were subject to some sort of a shutdown, shelter in place order or directive. And so based on that, we used some of this CARES Act funding, and we also went to some larger employers that had access to PPE through their supply chains, who had donated masks and other equipment to the state of Utah. And so through public-private partnership, we created what we call the PPE Push Pack program. If you could switch to the next slide, that would be terrific. The goal of this program was to help get companies, particularly small ones who had cash flow issues as a result of COVID-19, to help them get through the first week or so of operation until they could go out and develop their own access to PPE for the long term. And we also wanted to help our smallest employers. Again, these are the ones that we recognize were likely the most impacted from a revenue standpoint. And so we set some criteria around it, that the business needed to have fewer than 50 employees. They had a greater than 1 risk level. So in other words, they were not primarily office workers. We weren't looking for law firms or accounting firms or others. We wanted it to be for the private sector because the public sector can go out and use a little bit of its own buying power to get this type of goods. And we were already taking care of our medical workers through an existing program that the state had put into place, as many other states across the country had. So this was the criteria that we used. And now if you can go to the next slide. Once we narrowed down that criteria, we realized that we were working with about a third of the state's workforce, and that for 1 week, it would cost about $8.8 million at a cost per capita of $14, which happened to line up really nicely with the amount of funding that we had received from the state that was authorized for this initiative, and that combined with private donations. So finally, if you could switch to the final slide, we then developed a web form. We put it on the state's coronavirus.utah.gov website, which is where we're aggregating all of the coronavirus resources and information. And we had a really terrific uptake. So Utah, for those of you who aren't familiar, we have a Wasatch Front region, which is where the primary economic activity is. It's where a lot of the advanced manufacturing occurs, and it's about an 80-mile radius. And that 80-mile radius comprises Salt Lake, Davis, Utah, and Weber counties. So unsurprisingly, those 4 counties made up the bulk of the requests. But what I'm happy about in this slide is that there are 29 counties in Utah, and there was at least 1 push pack requested in each of the 29 counties. So we had great statewide reach. And if you'll click over to the next slide, we had over 3,600 PPE push packs requested, covering 43,000 employees across all industry categories. So personal services, of course, was a big push for us because those businesses were reactivating. Restaurants and hospitality, again, heavily impacted from an economic standpoint, and those that whose workers need the protection and whose customers need to see those workers protected in order to feel like they can go and safely begin to engage in the economy themselves as consumers. So again, the purpose of sharing this is not to do anything other than to say thank you so much to our colleagues in Washington, our new friends who really helped us take this bottom-down approach, supplement it with a top-down approach of a model, and to put into place in relatively short order a terrific program that's already had an immediate and important impact in our community. These pictures you see on the slide, on the left-hand slide, this is the state's PPE warehouse, which is in our convention center, which is not being used to host events right now. And then on the right-hand side, you see the packs being loaded up into trucks that are being delivered all over the state of Utah. So again, I owe this group a huge debt of gratitude for the inspiration and for the generosity of time. So thank you so much again for the work that you're doing and for being so willing to share it with other communities as our whole country and our whole globe really battles this pernicious disease.
Teresa, this is Matt Bogosian. Thank you for that. Can you speak a little bit to how you were already working on this PPE in the state of Utah was, and then you came across this model. How quickly were you able to interact with Rich Tong, who we're going to hear from? Tell listeners a little bit about your path to utilizing their model.
Well, Dr. Larson could probably correct me if I'm wrong here, but I think she sent me the PowerPoint on a Monday or Tuesday, and we were on a call with Rich and David on Wednesday evening. And then this push pack got rolled out the following Monday. So it was in the span of 48 hours that they were so kind to be able to hop on a call with our unified command to walk through the model. And then they continued to work with our vice president of research, who's a statistician, to help him be able to apply the same principles to the Utah model. So it happened really, really quickly.
Great, thank you, Teresa. And that's what we're hoping to offer up to others around the country is an easy and pretty quick on-ramp to taking maximum use out of this predictive model. So thank you so much for that, Teresa. Before I turn it over to Rich Tong to talk about the model itself from his team, I neglected to introduce Bharat Shyam the same team working together. And I think Bharat, if folks have questions that do come in, I think Bharat is going to help synthesize those at the end. If we have time, then those questions can come to Rich. So without further ado, let me turn this over to Rich Tong to talk about the model itself. Go ahead, Rich.
Hello, everybody. How are you? Well, thank you very much, Teresa. It was so gratifying to hear what has been happening in the state of Utah. It's one of my favorite states, and I thought I'd just have a picture here of Zion National Park, just so I could remember my last time there, which was 5 a.m. in the morning trying to do that angel walk. In any case, I'd like to show you some slides, if that's possible. So please let me know if you can see this. How is that looking, everyone?
Yeah, I can see that. Fine.
Okay. What I'd like to do is take you through how the model works, what it does, and some of the things we can do, and hopefully we'll have time for a short demonstration. So just to give you a sense, we are a collection of private citizens. We live here in Seattle. I actually have a very good friend in Utah right now who just texted me. So thank you very much for everything you're doing to keep everyone safe. We have a little group here. It's very informal. Actually, Teresa, you said last week the group is about 22 days old. So it's dedicated to one idea, which is that to responsibly restart the economy, we need to do that, and we can do that by saving lives and livelihoods. And our principal goal is to empower youth. The community is what's going to make this happen. I'm just so inspired by your PPE packs. We take that all in as a best practice and spread the word. The agenda today should be pretty brief. I'm going to just explain what we're doing, talk about the need for consumer confidence to enable a restart, and talk about some solutions for the next 90 to 120 days. Now, you're only seeing about a third of what we're doing. We all, in addition to the model, we're also working on adoption tools. So getting people to use it. The PPE pack is going right into that list. And also resources for people to be effective, because a lot of this has to be learned very, very quickly. We only have days, not months, to figure out how this all works. But today we're going to talk about the model. But first, a disclaimer. The state of Utah understands this very well, I think, but we're not medical experts. We're not policy experts. We're just concerned citizens. I would also comment models here do require complete validation and consultation with the appropriate bodies. This is not an advice. This is not a projection of the future. This is just a series of what-if scenarios. Now, we've worked hard to make the numbers representative, but they're not necessarily applicable to your situation. I was very gratified to see the Utah numbers because they're about in the model range when we did the original projections for Washington. So that gives us another feeling the model is somewhat stable. But the main goal is to demonstrate just one way of thinking. This is an impossibly complex problem, so it's just one way. So we advise you to use as many ways as possible to think about saving lives and livelihood. In a nutshell, I just want to thank a number of people. Our mission was basically to protect everyone and help restart the economy. We had a tremendous amount of guidance. The World Health Organization has a public website. CHI is another group, the Department of Health in our own state. IHME, which is a group in the UW, University of Washington, the Association of Washington Businesses, the Commerce Department, of course, has been super amazing. Pierce County, Chamber of Seattle Commerce, and the current model in this formulation has now been handed to the Office of Financial Management in the Washington state, so it's now part of the official forecast methodology for Washington. And we want to give a big thanks to Mark Baldwin, who is in charge of that model, and I do talk to him and his team daily. Now, the key thing, though, is to make it practical. And just to give you an overview of what we're doing, our goal is to have a data-driven model that's complete and that tries to help you anticipate the demand for PPE and soon testing and other materials. The second is to ensure adoption. Having the right messages, a campaign in a box, the right policy, and other frameworks for the most vulnerable is very important. I was very gratified to see what you're doing for the smaller businesses who really don't have the wherewithal to figure all this out. And the last thing is we are developing training resources. This is really another open source collaboration effort so that even the smallest organization can restart smoothly. Our next steps here are pretty simple. We just want to be helpful. We want to validate the needs and move forward from there. So why are we so focused on whole population protection? Well, it's pretty simple. If you look at other epidemics, if people are scared, they're not going to come out and work and live in the economy, and that's very important. So the economy needs to restart, phased way, but needs to restart in a way that everyone feels safe. So the three parts of that solution, the demand model I talked about, adoption tools, and resource and training, but today we'll just focus on the model. Some of you have heard this before, but I do want to explain that we did triangulate on this model using 5 different methods. We used data from the World Health Organization, the CDC, Washington itself, our Department of Health, and we also took a look at actual data in this state and around the world to ensure that we had a stable model. I would say that in all cases, this model tries to be, if you will, very conservative. So in any case where we had a chance to increase the number of requirements, we did, but that doesn't say the model is completely correct for your circumstance. Now, how does the model work? I know this is a busy chart, but I just wanted to explain it to you. This is actually from the WHO model, and it shows the amount of usage per person per day for a given piece of equipment. HCW is a healthcare worker, a doctor. Hygienist is someone who cleans up. A caretaker is someone who's looking after patients. An ambulancier is my new favorite word for an EMT. And then, of course, we have patients. The WHO model was developed for surge needs in epidemics in remote parts of the world. So imagine you're in Sierra Leone, you've got an Ebola crisis. What do you need to put on your C1s? It goes to, for instance, here it says, an examination glove, 6 per day per healthcare worker is needed. Surgical gloves, you need 1 a day. Surgical tops is 0.3 because basically there's you can wash them, and so on. The model is very complete. It even includes gum boots because sometimes those are needed in things like the Ebola crisis. What we then did was we took the model. Sorry, clicking too fast here. Oh, yeah. We took the model and applied it against all healthcare workers. Now the model is completely arbitrary and flexible. You can have as many levels as you want, but what we did was we said, just as a demonstration, the highest level is level 6. This is the source here is the Department of Health and the World Health Organization figures. And what it says is that on average, you need 1.18 masks per day per healthcare worker. We do the same thing for ASTM3 masks, which are the most protective, AST1 and 2, which are less. And you can think of a non-ASTM mask as a cloth mask, something that someone in the civilian population might use. Includes face shields, gowns, disinfectants, and so forth. Now, these models are not worthwhile unless you do an analysis that says they actually represent reality. Multicare is the 2nd largest healthcare provider, second to Providence in Washington. It has 4,000 healthcare workers, 17,000 total employees of the 440,000 in Washington. Their mask usage pre-COVID-19 was 25,000 masks per day. As of a week ago, they were using 15,000 masks because all electives are canceled, all non-critical was canceled, and they were using extended conservation measures. They estimate that if they return to normal, so no surge of resurgence of COVID, they could probably get 5,000 masks a day using extended conservation to cover everyone in the hospital. Now, how does that align with the model? Well, we ran the WHO, what's called raw model, at full surge. This
it's
means
9 hours.
Completely inundated with patients out the door. What would the model project? And it projects 100,000 masks per day are required. Our model, which takes those WHO estimates and runs it for a normal case, says they would need 45,000 masks. If you look at the current demand, that's down here, you can see that 45,000. Now, this fits pretty well because 25,000 masks conservation is probably pretty close to 45,000. What this means is this model is not a plus or minus 2% model, it's a plus or minus 50% model. The idea is to give you a range of need. Because this epidemic is so variable, protection levels are just coming out, it's just in the ballpark system. We then asked ourselves another question, which is, let's look at, apply the WHO model not to the entire population of Washington state. And this is the model that was used by the state of Utah. This is surge forecast based on prior epidemics. We use two different methods. One is to take Washington as a percentage of the US in the WHO model. The WHO model is only available to member states, so it does not include what they call regional cuts or state cuts. We also use some data from other populations like Taiwan, where they have some rough guides for how many masks are needed for the general population. What the model shows is, and this is a specific analysis that was done for the Washington State Unified Command last Thursday. It was an estimate, and I want to have a shout out to Michelle McCormick, who is the Microsoft loan executive, very, very smart person working for the state to procure things. We also have an Amazon loan executive in the state, and they wanted to know, do we have too much or too little when we restart? What this estimate shows is the 30-day stockpile requirements for the state of Washington. By the way, the state of Washington, for what are called Tier 1, which are all healthcare workers, well, they had about 7 million masks per week on order, and they needed to know in July, August, September, how much they would need. This model shows they need about 5 million masks. The first column is the US overall. It should scare us all a little bit that in full resurgence, the US would need about 1 billion exam gloves per day. The numbers are just simply all staggering. But I just wanted to give you a sense for what some of these numbers are. It's about 800 million medical masks, and we hope this never happens. But in surge forecasting, you have to plan for the worst. This next column shows Washington, about 7.6 million people. We just took a percentage of the US. So these numbers are basically 2.8% of the United States, and it shows about 20 million masks per month are needed. Thanks to help from the WHO and others, we were able to then tune the WHO model specifically for Washington's actual healthcare capabilities. And that number comes out a little lower, but it's still in that range. So again, this gives us confidence the model is stable. So if this works, the question is, how should this work for the broader community? I'm sorry, this is a little crazy here. If this works, how should it work for the broader community? So this shows the spreadsheet fully filled out. So you saw last time the healthcare workers down here. This then estimates what's needed for blue collar workers. The source for us is the Washington Labor and Industry. We have a regulatory group here. And so these numbers, which basically shows on average that a blue collar worker would need 3 to 4 ASTM masks. 12% would need a face shield every day and so forth. There are other estimates for customer-facing workers. Our government is right now going through those numbers. So if you were to use this model, you would have to apply the various regulations, recommendations in your own communities. Now this is one what-if analysis. This is very similar to the Utah analysis, and it asks the simple question. I call this the Barack question, because he's so smart about thinking about the big picture. And that's a simple question. If every healthcare worker, and this is every clerk, every staff member, every accountant in every healthcare center had full protection and they looked like had a moon suit, and every other one else, every civilian got a mask, what would it cost? In this particular analysis, the average was about 2 masks per day. If you do the per capita per day estimate, that's about $2.50 per day. If you then analyze that versus the pre-COVID-19 GDP of the state of Washington, that's about a 1.2% GDP hit. And we did this analysis to basically help the economists and policy planners estimate what a certain regulation might cost and whether it's practical. We went deeper, as mentioned in the state of Utah analysis. We did go through the so-called NAC codes for every employer in Washington. There are 2- and 3-digit codes. And basically, this allows you to do a sector-based stage restart. These are the GDPs of the various economic sectors in the state of Washington. You can then estimate what's the most effective thing to come back into operation. The state of Washington and Utah is very similar, has a list of organizations moving, and they are not surprisingly In our state, because we have Boeing and so forth, and we have a very big construction boom. Manufacturing construction has been online first. Agriculture, fishing, and hunting is easily the distance, so that's been second. Postal transportation is next, and so forth. Just to give you a sample, I'm not going to show you the entire 4,000 line spreadsheet, but it looks sort of like this. You can basically fill in, this is the total private sector employment. You fill in a protection level, you fill in its stage. You can then cut it by different categories. So total private includes goods producing, there's logging, and so forth. And you just fill in different sections and it comes out with different estimates. In this particular scenario, we did go through this through the state of Washington, and it showed that the GDP hit was somewhat higher because manufacturing construction was not applied in the base model, but it's still about 1.3%, about less than $350 a day per person to get back to work. Now, of course, this assumes that literally 30,000 masks a day are thrown away, and that's not either environmentally conscious or super cost effective. So in this case, we just made some assumptions that 50% of the civilians would use a washable cloth mask. The current research shows that a cloth mask that's about 60% effective can significantly reduce the chance of spread. And that shows the GDP hit is down to 0.8% and the cost per person per day is down to $1.90. So a small cup of coffee. Last thing we did was the model based on SOC codes, so standard occupational codes. This gives you a finer grained sense for what can happen. For instance, in Washington, my old job, we have 6,000 marketing managers, and it lets you take a look and say they need a protection level of 2 because they're in the office. We all know marketing managers are not essential, so I gave that a 0. And by the way, I was highly tempted in this model to increase the barbershop and barber rating very quickly because I need a haircut. This shows a slightly higher number because, again, it's more detailed, but the numbers are still in this range of 1.6% GDP or $350 a day. With conservation, it's about 1.1%. So again, every model is going to be different. Every situation is going to be different, but this is the way we look at model stability. The final piece is, excuse me. To look at some needy segments. We have been doing some additional slicing. We, for instance, have looked at the NAC code 624 for all social assistance employees. There are some people who are not covered. In Washington, there's 22,000 homeless. The unemployed are not covered in the NACS codes. There are migrant workers. There's in-state support, self-employed is not included. And so like the state of Utah, we did an analysis for some of the most needy. And we're also happy to work on that for other populations as well. This, by the way, led to some direct policy implications. We're not lobbyists. This is not what we do, but it does lead to some observations. So for instance, in Washington, Commissioner Kreidler has already decreed that COVID-19 is part of the healthcare plans. And one of the big questions is, should healthcare pay for PPE? For instance, if insurance covered for a $2 pack of cotton masks, which would cost about $2 to $4, it basically saves between, at least in our state, between $20,000 and $50,000 in intensive care costs. So safe hospitalization would pay for a lot of masks. The second issue is that PPE needs for dentist office, therapists, and so forth is rising. And if that's a cost of business, should that be passed on as an insurance claim? So these are some of the policy implications, and we're not making any recommendations, but an example of the use of the model. Now, what's the next step for the model? Well, that is to enable this to run and slice automatically by state, county, and city. Utah has an excellent resource. I just want to have a huge shout out to the group that worked on this. I had a wonderful conversation with a true Excel expert as opposed to myself, and hats off to you for doing it, but not everyone has that capability. So if it's okay with you, do we have time to just show our latest model split?
Yes, I think so. Go ahead, Rich.
Okay, I'm going to stop this share and then hopefully switch to the live Excel spreadsheet. So apologies if it doesn't work exactly quickly. Okay, hopefully people can see this.
So as I said at the outset, Bharat Shaim is on Rich's team, and he's served previously on the governor's task force in a previous administration in the state of Washington. So, Bharat, if you have questions coming in at the end of Rich's presentation, Bharat, you can synthesize those for Rich. Thanks for doing that.
Yes, I want to thank. But
we got some questions online, but they were mostly answered during the YouTube chat. So nothing outstanding right now.
I just want to thank Bharat as the former Chief Information Officer of the state of Washington and as a longtime colleague. His expertise in working with the government has just been invaluable. So thank you very much, Bharat. Okay, this is the first view you'll see. I just got this working last night, but one of the problems is it's quite difficult to figure out how to use the model and employ it. So this is a summarized view, and the big change here is that you can now basically cut the model by state. So for instance, the state of Wisconsin has been asking questions about how they work. This is, by the way, the state of Utah. You can actually.
I'm just going to pipe up for 1 second here and just apologize because for some reason the text quality is coming across a little fuzzy on YouTube, but
Okay.
just speak to the line. We can always share.
Should I increase the? I'll increase the zoom. And
No, it's not the zoom. It's just the quality. The image quality is poor, at least of what I can see. So just read out what you're showing.
Okay, I'll read out what I'm doing. Thank you very much, Bharat. Okay, and I'll try to. We'll try to get even bolder. Is that any better, Bharat? Is that any better, Bharat? Okay, so I'll just read through it. What this shows is a data cube, and so it lets you slice the information, which is in this case NAICS codes or the job classification codes. We can, for instance, look at federal employment, local employment, private employment, state government employment, because those are all different categories. We also have available now the ability to look at the data at a state level, a metropolitan statistical area level, and a county level. So you can actually go in and say, what is the need in a particular county? Finally, the hard work that the state of Utah did, which was to update the model, has now gotten a little simpler. Sorry about that, guys. But for instance, you can now go to, say, the state of Utah and do a poll, and it shows you number of employees by major sectors, the average weekly wage, which we use as a proxy for starting earlier, because typically people with lower wages are going to spend more, and that's better for the economy. But you can see here that there's a good producing sector, and part of that is natural resources, construction, manufacturing, and then the service providing area, which includes transportation, information technologies, and so forth. And I did not yet validate this model, guys, but I just wanted to give you a sense for how it works. You can then assign a protection level as previously described, and then you can get a calculation for mask, gowns, and gloves. So this automatically slices the data for you. Just to provide a particular example of that, you could, for instance, if you want to look at what's happening in Salt Lake City, you can actually look at just that county, thusly, or you can look at any other counties. So this would allow, for instance, if we know the state of Wisconsin, for instance, is interested in this model, we'll give them an easy way to do a very quick rough cut and get to their numbers. So a completely different number set, but the calculations stay intact. Okay, I think that finishes the formal presentation. Let me see, I think I have one more slide.
Great, Rich. This is awesome. So let me pose, this is Matt Bogosian. Let me pose a question to Bharat. You were the former CIO of a previous governor, right, Bharat? And so I'm thinking you can appreciate, the interest across the country, to the people I talked about that are on this call. They're thinking, this could add value where I am, whatever perch people are on. What's the capacity of you guys to interact with other jurisdictions to apply this model?
Why don't I take that one? Our goal is to basically support as many people as we can. So, I'm sure we'll run out of capacity at some point. I think we'll be looking to the great state of Utah for some help as well, because if people need help, we view this to be a community effort. It is going to be an open source model. So our basic idea is we're going to keep trying to fulfill demand until we can't, and then enlist others who are right behind us to get more help.
Yeah, and we're also trying to raise some resources here to anticipating the demand, and we're putting in some work to make it easier for people to do self-serve. So we're sort of marching along both those directions. So send us email, and we'll jump on it.
Great. And how would people get in contact with you guys?
hello@restart.partners or info@restart.partners.
And I think folks can also, send an email to me, matt.bogosian@amccmail.com. Also, Justin Boss, wherever you got the notice for this webinar, you can contact those folks, and we'll channel those requests to these modelers so that they can engage with you to utilize the tool. I mean, this is what's great about getting it used in Washington and Utah and elsewhere is that's a real-time feedback loop to perfect the model, and that's what we need across the country. So I think on behalf of everyone, we really appreciate your leadership, bottom-up leadership in putting together this model and seeing how it holds up and perfecting how we prepare for this crisis. So thank you both. Bharat, were there any other questions that came through to you?
Nope, we answered them on YouTube.
Okay, great. So I think that's it. We're going to give you back 10 minutes of time. This is Matt Bogosian from AMCC saying thank you for participating in the webinar, and good luck and be safe, and hopefully we'll be in touch soon. Thank you.